Welcome back to the Uprise Doctor to Doctor series, Documentation Best Practices. We are going to review a best practices approach to glaucoma documentation. Hi, I'm Kim Castleberry, and I'm happy to share my thoughts from the perspective of a 25-year veteran Medicare auditor and the primary design consultant for Uprise EHR. I hope the next few minutes reviewing glaucoma documentation is helpful in streamlining your practice efficiency and get you home quicker. CMS guidelines dictate medical necessity should be directly stated or easily implied in the medical record. Years of reviewing Medicare claims taught me what is easily implied by one auditor is not necessarily by the next. So I learned to both directly state and easily imply medical necessity, and I've never failed an audit. I'm happy to tell you that I designed Uprise to support automatic documentation of medical necessity for both exams and procedures, special testing, and surgery. Starting with the exam chief complaint, the primary reason for the visit can be selected and designated. PFSH supports past ocular and family ocular history and can be automatically updated from patient questionnaires. Vitals support IOP, prior IOP, IOP targets, IOP graphs, cup-to-disc ratios, and pachymetry findings. Physical exam supports glaucoma treatment code mappings that automate findings, assessment, plan, orders, procedures, counseling, and coding with a single severity-based ICD selection. Mild and moderate severity selects supportive and special testing treatments, and severity selects additional surgery or referral treatments. We call it Smart Touch. It's an industry first with built-in clinical decision support at the point of care. Physical exam also provides support for automatic glaucoma severity selection. Just select the glaucoma type and mild, moderate, or severe, and Uprise displays the correct ICD code automatically. Favorite also provides additional support for treatment compliance ICDs, and they're particularly useful for non-compliant patients. So let's take a look at how glaucoma works in an Uprise exam. Let's start by just simply documenting the exam and closing it, just to show you how quick and easy glaucoma documentation is. Then we'll go back and deconstruct and look at the details. We're going to go down to the physical exam. After reviewing the IOPs, the pachymetry, and cup-to-disc ratios that the staff has already placed there, we're going to go down to the physical exam and go ahead and make our documentation selections. We've got mild. After reviewing everything, we've got mild glaucoma. So we'll select the category selection, glaucoma, and we've noted that the anterior segment and the posterior segment is otherwise normal, and we'll process this screen. We're going to go down and select both eyes as primary open-angle glaucoma, and mild as the default, and we simply select Finish. And now we're going to go down and select the special testing that we need to do today. So we're going to do OCT of the anterior segment. We're going to do fundus photography, visual fields, and pachymetry. And my staff is going to come back and add orders for the next visit. And we're also going to go ahead and have my staff, or I may select that we're going to educate patients about fundus photography, OCT, and glaucoma. And then we simply sign the exam and go home because we're done. Now let's deconstruct the exam and take a look at some of the details. I'm going to go ahead and unsign the exam record, and we can see the patient again was coming in for a glaucoma exam type, and the chief complaint was listed here as a glaucoma evaluation and a doctor recommended return. The past family social history was detailed here, and the vitals are here. So during the exam, you can certainly look at pressures and pachymetry and even CD ratios here, and my staff had gone in and populated that from the OCT findings, but you can also edit them here. You can go down here and you can fill these out yourself, or you can import them from a previous exam, or you can go ahead and get them if you have integrated equipment. You can import them here as well. Alternatively, you can also put the cup-to-disc ratios in during the physical exam. So let's go ahead and cursor down to the physical exam. when you do the physical exam, you also have access to the vitals right here. So you can add your cup to disc ratios here as well. And of course, you can also go get them from a device or import previous data as well here. Now, looking at the details of the physical exam, let's go look at it. We're going to cursor to this screen. We can see here we have all of our favorites starred right here. And when we went in and selected the primary open-angle glaucoma, we have the opportunity to select or to go ahead and use the default mild severity, or we can change it to moderate or severe. And in this case, we left it as mild. Now, what that does is goes in and automatically selects the mild primary open-angle glaucoma ICD. If we had selected moderate, let's go see what that looks like, then we're going to see that it is now all of a sudden the moderate primary open-angle glaucoma ICD. And if we select a severe, same thing happens. It puts a severe ICD in there, but we wanted to leave it as mild, and there it is. We have also added the non-compliant ICDs to glaucoma for convenience reasons. You'll find them down here at the bottom of the favorites. And these are the non-compliant ICDs that indicate, for instance, in this case, a patient unintentional underdose of medication regimen due to financial hardship. We've also got others for underdosing of medication regimen for other reason, and we've also got one for unintentional underdose of medication regimen due to age-related disability, and then one just for other reason, and then a very generic one for just a generic non-compliance. This is particularly helpful for those medications that are non-compliant with their treatment regimens, and we can add these to the primary diagnosis. Now we can also jump down here and see our primary assessment has been made with primary open-angle glaucoma. We can see our special tests and procedures right here, and we can open one of them up, and the OCT of the anterior chamber, the interpretation report is already done, and you can see here that the insurance company has been assigned as well. And same thing for fundus photography. Same thing for visual fields and pachymetry. We've got orders that have been added here that I added during the exam. I typically have my staff go in and add any special tests that we might want to do for the next visit. It's also where we would add medications. So let's see how we'd add medications. This is where we would do our medication prescribing, just using e-prescribing. If you want to see the details of using this, just go look up our tutorial on prescribing medications with e-prescribing. And again, patient counseling items are selected here, and those will be sent to the patient portal. Or you can actually go ahead and print the CCD out and hand it to the patient. And we can see our coding down here has already been done. The intermediate exam has been correlated with the primary diagnosis and assigned to the insurance company. Same thing for all the other special tests. When you are ready to close the exam, when you sign it, you do have an opportunity to open the CCD if you would like, and to import any items or all the items. And then you can deselect items that you may not want to go to the patient CCD. For instance, if we don't want the BMI to go to them or the blood pressure, we can take those items out, and then we can preview the CCD if you'd like, and we can even print it out or even email it to the patient right here. But here are the demographics. We can see the problem list, the procedures that were done. We can see the plan of care and any vitals that we left remaining in there, and any instructions. And if we've got any referrals, it's going to be down in here. That's it for glaucoma documentation. I hope this helps your best practices effort. Look for other conditions in the Uprise training or on YouTube, and feel free to contact me on my email listed here. I'm happy to help. Thanks for watching. See you in the cloud.